I'm Dr. Myrna Matilsky, and I want to give you a little bit of my background and introduce my husband, Dr. Mike Matilsky. He'll speak just a little bit. I'm speaking most of the time. My background is mainly family medicine. I've practiced family medicine for just about 30 years. And in the last 10 years, I changed my practice towards functional medicine, which involves finding the cause of medical problems, treating the cause, reversing the cause, and hopefully not needing prescription medicines, which, as you know from watching TV commercials, come with plenty of side effects, and then often lead to needing more medicines. So I've gotten certified in anti-aging medicine, and I mainly practice now functional and integrative medicine and hormone replacement. We want to show you a video clip first. Mike will tell you a little bit about.
Well, I found this, and I don't know if you know Stephen Colbert. Maybe you do, maybe you don't. But before he became late night host, he used to have his own TV show. And there was a clip that pretty much introduces the topic that we're going to discuss in a completely ridiculous manner. But it makes everybody laugh, I think. And it's an interesting way to get to a serious topic. So if Meg presses the on button.
More on Martin later, but now, folks, you know, I always go from the gut because my gut is the largest single organ in my body next to my balls. Sorry, prostate, maybe next exam. But now, scientists say that the older you get, the less you can trust your gut.
We all have a natural suspicion in our brains, right? It warns us when somebody's not trustworthy or just trying to rip us off. You can just kind of feel it. But researchers say we get less skeptical as we get older.
Here's the bad news. It starts in your mid-50s. As we get older, we lose the ability to determine who or what is untrustworthy. Shelley Taylor, who is the lead researcher on all of this, says people basically, as they age, lose that gut feeling that, hey, something's wrong here.
Who'd have thought that elderly Fox News viewers would be more susceptible to misinformation? Now, folks, now my 50s are years and 2 years away, but I want to protect myself against becoming gullible. Fortunately, a man on TV is selling me a miracle cure that will keep me young forever. It's called Androgel, and it's for treating something called low T, a pharmaceutical company-recognized condition affecting millions of men with low testosterone, previously known as getting older. This testosterone supplement was originally available in a mere 1% concentration, or as I call it, man milk skim. But last night, when I was watching CNN's primetime lineup of ads for Ensure and self-lubricating catheters, by the way, great way to deliver Ensure right to the needed areas, I heard this great news.
Presenting Androgel 1.62%. It raises your testosterone levels and is concentrated, so you could use less gel.
What an incredible breakthrough. I don't know how it works or what it does, but now I can use less of it. The best part is this highly concentrated male sex hormone doesn't have one side effect. It has dozens of them.
Serious side effects include worsening of enlarged prostate, possible increased risk of prostate cancer, lower sperm count, swelling of ankles, feet, or body.
So, fellas, keep an eye out for any swelling here, here, or here. And that is not all that it is doing for you.
Men with breast cancer, or who have or might have prostate cancer, and women who are or may become pregnant or are breastfeeding should not use Androgel.
So you're fine as long as you don't have cancer, will never get cancer, are not pregnant, might become pregnant, or came into this world via pregnancy. And folks, never doubt Androgel's potency, because the side effects aren't just for you, they're for anyone near you.
Discontinue Androgel and call your doctor if you see unexpected signs of early puberty in a child or signs in a woman which may include changes in body hair.
Now, that sounds scary. That sounds scary. But if your 6-year-old girl gets too close to the Androgel, don't worry, you haven't lost a daughter, you've gained a cousin it. Now, Now, because it's so powerful, the makers of Androgel have produced a safety video that shows you how to safely contain the hormone Chernobyl that will be your bathroom.
This is Dave. He has hypogonadism.
And that is one of the least popular forms of gonadism. Okay, got to do something about that. So what do you do, Dave?
I apply it early in the morning while everybody else is still sleeping.
Okay, evidently you should apply it when your family is unconscious. It can't get them in their dreams. But let me ask you, Dave, what if I spill some?
If any excess gel comes out when I'm priming, I just wash it away down the sink to avoid accidental exposure to others.
Okay, I'll avoid exposing it to others by letting it flow into my town's water supply. And we're done.
So once I'm finished applying it, I rinse down the bottle and wash my hands with soap and water. Always be sure to rinse off the sink handles.
Okay, so I'll wash the Androgel, then wash myself, then wash everything that washed everything else. Or, let's see, or you know what? It might just be simpler to keep a bucket of fresh sink handles around. But folks, I say it is a small price to pay because now, with the Androgel, I'm all jacked and have the sex drive of a 25-year-old, and I am ready to thrill my wife.
If a woman or child comes into contact with the application area, that area on the woman or child should be washed well with soap and water right away.
Okay, no contact with women. Okay, no big deal. As long as you're careful, Androgel can still be just the thing you and your lady need to rekindle that old fire in the bedroom. But, good. Foreplay. But the point is, this mass-marketed, easily spread endocrine toxin is now available in 1.62%. Your balls will thank you for it. Seriously, they may gain the power of speech. But men aren't the only ones who need help in the hormone zone because according to the American Psychiatric Association, 11 to 41% of women suffer from a condition known as female orgasmic disorder. You heard that right, 11 to 41%. So this is either very rare or completely normal. The point is, women are doing sex wrong. Now, this orgasmic disorder is what I call low O, trademark. And folks, this may come as a shock, but Big Pharma has a profitable answer for that too.
Women who have trouble reaching orgasm during sex could soon get help, believe it or not, from a nasal spray.
They might also get help from that guy's mustache. So what is this miracle product?
It's called Tafina. Women would spray 2 pumps in each nostril about 2 hours before sex. It's expected to work for up to 6 hours.
Yes, it's good for up to 6 hours, although men are not. So, basically, it's a few minutes of intimacy followed by 5.5 hours of highly erotic scrapbooking. So just what's in there that's so good for women?
Tafina is a nasal gel that delivers a dose of testosterone directly to the brain.
It's testosterone. So it's just Androgel you shoot straight into your brain. So ladies, don't be surprised if your prefrontal lobe sprouts a handlebar mustache. So get Tafina, ladies, and if you can't afford a prescription, just tell your husband not to rinse out the sink. We'll be right back.
Okay, on a different note. You next?
I'll take that one.
Okay. All right, so on a more serious note, we could use the light back on. Okay, so we came to talk about hormones tonight, which are a somewhat controversial topic. And they became controversial probably in 2002 when the Women's Health Initiative study was reported in the news. It made big news, and it was actually stopped early. The study was supposed to go on for longer. It was stopped because they reported at the time that hormones are bad, they're no good, the hormones were found to cause breast cancer, stroke, and heart attack, and dementia, and increase the risk, and blood clots also. So women were told by the news media, not by the doctors, they were told by the news media, go off your hormones, they're bad, they're dangerous. So this news took women by surprise, it took doctors by surprise. We didn't know what to make of it. And what happened is over the next few years, when the data of this study were really analyzed, what they concluded, and they should have said at the time, well, hormones are not bad. Premarin and Prempro were bad because those are the only hormones that were tested in that study. Should I go to the other side?
Doesn't matter.
Better over here? All right, so Premarin and Prempro were the only hormones they tested. Now, what do you know about Premarin? Where does Premarin come from? Mares, horses. Comes from horse's urine. It's made from horse's urine. It's purified, but it's horse estrogen. It's not human estrogen, it's horse estrogen. So when you put horse estrogen into human women, you have to expect some bad things to happen. And then Prempro is a combination of horse estrogen with a synthetic progestin, not progesterone, but progestin, which is made from natural progesterone, but it's then altered so that the pharmacy industry can patent it and therefore make a profit on it. So they combined these two medicines together and they marketed this for women. So when they said that hormones are bad and hormones cause cancer and disease and heart attack and breast cancer, what they should have said was only Premarin causes that because they didn't test anything else. The other tests have been done, tests on other hormones have been done, and they've been reported in this country. They just didn't announce that, and little by little, people are getting more used to using the natural hormones. So what I want to talk about today, I have an outline of what I want to talk about, bioidentical hormones versus synthetic hormones. I'll explain the difference. Estrogen, testosterone, and progesterone, and I left out the line above. Okay. A little bit about thyroid hormone and vitamin D, the symptoms of hormone deficiency or imbalance, menopause and andropause. I'll explain andropause, we'll get to it, methods of hormone replacement and studies that show it works, and then what you can do about it. So what are hormones? Hormones are chemicals, they're little chemicals, they're made in the body, in the glandular organs of the body. They get secreted into the bloodstream, they travel through the blood, and they go elsewhere from the place where they're made to exert their function. They tell every cell in every body, in every organ, in the whole body what to do, and you couldn't live without them. There are over 100 different kinds of hormones, and you can't say right across the board that hormones are bad. You have to have hormones for life and to function. So hormones can be classed in different ways. They can be classed as fat-burning hormones and fat-storing hormones, and the fat-storing hormones largely are insulin, estrogen only when it's unbalanced by progesterone. It is not a weight-gaining or fat-storing hormone when it's balanced, and cortisol. So you might be thinking, well, many women gain weight as they get older and they lose their progesterone. They still have some estrogen, they gain weight. Insulin, you don't want to get to the point with diabetes where you need insulin because it causes weight gain. And cortisol is a stress hormone. I'll talk just a little bit about them. Thyroid, though, thyroid has a lot to do with metabolism, and I think people understand that thyroid has to do with weight gain or weight loss and metabolism and feelings of energy and well-being. And many people go to their conventional regular doctor and they want their thyroid test, or they get their thyroid tested because they have a feeling they're gaining weight and they're tired and fatigued, possibly because of low thyroid. So the doctor does a thyroid test and often tells people that they're normal. Well, the normal level for T4, which is sometimes checked by conventional doctors, but not always. Conventional doctors, most of the time they check TSH. TSH stands for thyroid stimulating hormone, which is not a thyroid hormone at all. It's a brain hormone that tells the thyroid gland to make more or make less thyroid hormone. Unless you test the thyroid hormones themselves, you don't really know what the thyroid is doing. So we test the T3 and the T4. The T3 is actually the more active of the two hormones, but the T4 is the one people know more about because some doctors do test T4. So free T4, the normal range of T4 is given by most labs, including LabCorp and Quest, as 0.8 to 1.8. But the optimal level is really the higher end. So what I'm aiming for is 1.2 to 1.8. So when people get a thyroid test and their free T4 is 0.8, 0.9, 1.0, I would call that suboptimal. People who are tired, fatigued, have no energy, and are gaining weight would feel better and do better if we give them thyroid hormone replacement and raise that thyroid level up above 1.2. Now, the other thyroid hormones, the free T3 is another one. The normal range given by the major labs is 2.4 to 4.4. That's the bottom line. But the optimal range is the upper half of that. To get that up there with standard thyroid replacement, which is levothyroxine, which is only T4, it's not going to do it. And the problem with most people as they get older is the thyroid no longer converts T4 to T3, and people need a supplement of T3. This is very common. This thyroid problem can start in the teens and 20s, but by the time people get into their 40s and 50s, it becomes common. And by the time people are in their 60s and 70s, most people have a thyroid conversion problem and benefit from T3 replacement. All right, the idea is do the test. You have to do the right test to find the right answers. Testosterone, I'll talk about real briefly, and then we'll come back to it later. For men, the normal range by labs is given as 200 to 1,200. So many men ask their doctors for a testosterone test, which doctors will do because it's readily tested, whereas women, unfortunately, can't go to a conventional doctor and ask for hormone testing. Insurance won't pay for it. Now, why insurance will pay for men to get a testosterone test, but won't pay for women to get an estrogen, progesterone, and testosterone test, it's beyond me. It's unfair. It makes you wonder who's setting the rules with the insurance company. However,
insurance success, who are men?
Well, probably. All right, so anyway, when men get a testosterone test, normal on the lab slip says 200 to 1,200. So many men come out with a level of 250 or somewhere around there, and the doctor tells them they're normal, but they don't feel normal. Men with a 250 don't feel normal. Now, what the doctor hasn't told them is the reason there's a range like that is because young people, like 18-year-olds, start out with a testosterone level of 1,200. 1,200 is normal for an 18-year-old. 200 is normal for a 95-year-old. Well, when you're coming up with normal levels, you average everybody together. That's the way normal levels are determined. So 200 is average for a 95-year-old. 250 is average for a 90-year-old. And most men, even the 90-year-olds, don't want to be average for a 90-year-old. 90-year-old men want to be average for a 50 or 60-year-old man. You know, who wants to be like a 90-year-old man unless they have lots of energy like a younger man? So you can't just go by what the lab slip says. We're aiming for optimal. So when I replace testosterone for men, I'm aiming for at least higher than 700, really better higher than 900. 900 to 1,200 is what I'm really aiming for. And a conventionally trained doctor, not trained in functional medicine or hormone replacement, will look at a man with a 250 or 300 and say, you're normal. You don't need thyroid replacement. You don't need testosterone replacement. And if men have a level of 500, 600, 700, they're going to say, oh, you're fantastic, because they don't normally see that level in men who are coming in to ask for the test. For the most part, the 20 and 25-year-olds are not asking for this test. It's older men who want to have it tested and suspect there's something wrong. Now, I want to divert just like a minute and explain this, which is sort of a busy slide and a little bit hard to understand, but I'm going to explain it. The numbers along the left side, the y-axis, are different levels of testosterone, and along the right side, in men, this is in men, on the right side you see different diseases. So down at the bottom, at a level of 200, is erectile dysfunction, meaning with a level of less than 200, men are very likely to have erectile dysfunction and have trouble maintaining an erection. But look at 400, 350, the mid-300s, coronary heart disease. Men with a level in the mid-300s are likely to develop heart disease. This puts them at high risk of heart disease. And if we get the level up higher than that, it lowers the risk of heart disease. Look at 600, mortality from all cause. Men die more when they're more often, they don't die once, you can't die more often, but more men die with a level of less than 600. Getting it over 600 improves every chronic illness condition that we could name. Look up there at prostate cancer at 840. We get a level of 840. Testosterone prevents prostate cancer. If we think about who gets prostate cancer, it's not the 20 and 25-year-olds who have that 1,200 level. They're not getting prostate cancer from high testosterone. It's the older men whose level has dropped down, and that's when prostate cancer becomes more common. And look at 900, Alzheimer's disease. Did anyone ever tell you that you could prevent Alzheimer's disease? Well, you can. There are a number of things we can do to prevent Alzheimer's. Many people think they had a parent with Alzheimer's, they're going to get it too, or they're at high risk. There are a number of things we can do to prevent Alzheimer's, and one of them is replace hormones, because hormone replacement tremendously lowers the risk of Alzheimer's. Now, I don't have a slide like this for women. I wish I did. Women are more complicated. I don't know if anybody has made the slide yet or done the research to come up with the slide, but women would have to have estrogen, testosterone, and progesterone balanced, but the same thing applies. In women also, when you have high enough hormone levels, you prevent disease. And this is my main #1 reason for replacing hormones, not just to make people feel better, but to improve disease prevention. I want to prevent diseases. As a family physician, it makes no sense to me to do what my training was, to wait for people to get sick, wait for people to get a little older, they get sick, and then come in and I'll prescribe pills for them. And then they'll go home, take the pills, and the pills are going to make them sicker in one way. The pills might help something, but it'll make them sicker in some other area, and then I'll prescribe more pills. Well, this is what medical training is. It's to prescribe pills, surgery or pills. So I'd rather prevent the disease than let people get it and then have to treat it. All right, so this is just a summary of the testosterone. Again, cortisol was a stress hormone I mentioned before. I don't check cortisol in everybody, but there's certain people with certain conditions, mainly stress. I do check cortisol, and it's not as easy as the other hormones to check, which are straight blood tests. Cortisol, the level changes through the day. It starts out high in the morning, that's the first dot. The second one is, it should, normal. Normal is high in the morning, lower at lunchtime, still lower at dinner time, and much lower at bedtime. This is a normal pattern, but if you check it only once, like a fasting blood test, you can't tell if the cortisol is normal or not because you don't see the whole pattern. So when we want to check cortisol, we do it by saliva. We give people a saliva kit to take home. There are 4 little bottles in the kit. We ask them to put saliva into the little bottles 4 different times of the day, and then FedEx the kit in. We get a result back a few weeks later. Then I meet with them and I go over the results, and we do what we need to fix it, to bring the stress level down and to bring the cortisol level down. This helps with weight maintenance and help balance. It's part of balancing the hormones. So get the idea that normal and optimal are not the same. All right, what the lab slip says is normal is not necessarily normal. It's more or less average for an entire population. All right, so when people come in to me, the main symptoms they come in with, well, before the main symptoms, I want people to feel good. Besides preventing illness, I want them to feel good also. So I ask people how they feel. This is not the way most people want to feel. This is very slow. All right, you don't want to feel like this either, like angry, stressed, depressed. People, for the most part, want to feel relaxed, calm, balanced, hormone balanced. These people look good, they feel good because their hormones are balanced. Now, people who have hormones balanced naturally, for the most part, are the 20 to 30, 35-year-olds. They have natural hormones. But what happens after about age 35? Hormones begin to gradually drift down. It's usually not noticeable. Now, in women, when they go into menopause, it is noticeable. They have a period one month. The next month, it's not there, or it could vary, and they know when menopause is. Men, testosterone just gradually drifts down with time until they get to the point of not feeling well. But most men over age 50 have noticeably low testosterone, and plenty of men below 50 also have low testosterone. And low, I'm counting as less than 900, official low, less than 500. But the only way you know is you get a test. So the main symptom I get when I ask people, how do you feel? What do you think they say? Most common symptom, come on. Tired. Tired. Fatigue, tired, no energy, can't get up in the morning. They have to drink coffee first thing in the morning. People shouldn't drink coffee because they have to drink coffee. They should drink coffee because they like coffee and want to drink coffee. You shouldn't need coffee like a drug to get you going in the morning. And then people get fatigued and tired in the afternoon. So what do they do in the afternoon? They either drink more coffee or they take an energy drink. And then those same people often can't sleep at night. So then they want a sleeping pill at night. So they want something to energize them in the morning and a sleeping pill at night. All right, next, other major symptoms that I get people complaining about, mood changes, mood swings, anxiety, depression. Whoops, I didn't mean to do that. Wait, come back. Yikes. Okay. anxiety, depression, irritability. I think everybody knows somebody who's taking antidepressant or anti-anxiety medicine. And the television commercial asks you, do you feel sad, depressed, down in the dumps? Go ask your doctor if Prostate or if Zoloft is right for you. And if the television commercial really wanted to help you, they wouldn't tell you to go ask your doctor for their medicine that they're going to make a profit from. They would tell you to go ask your doctor, why am I depressed when for the first 40 years of my life I wasn't, and now that I'm 40 or a little bit beyond, now I'm depressed or now I'm anxious. And they should look for the reason. And if they looked for the reason, they would find it's hormonal changes, usually progesterone dropping down about 10 to 15 years before menopause. Memory problems. Lots of people complain, this is women and men, complain about lack of focus, lack of concentration. They can't think clearly. They feel foggy brain, cloudy thinking. They're not so productive at work as they used to be, can't accomplish as much. And to get rid of foggy brain, we either need thyroid adjusted, but also women need estrogen to have clear thinking, and men need testosterone for clear thinking. Next column, hot flashes and night sweats. I think women understand when they get hot flashes and night sweats that that's hormonal change, and it's hormonal related. And many people will go to their conventional doctor and ask for something for the hormone replacement. So unfortunately, some conventional doctors are still prescribing Premarin and Prempro because that's what they know. That's been known for years, and they haven't educated themselves as to what's new in the hormone field. And many doctors will say, conventional doctors will say, well, it's temporary, it's going to go away. But people shouldn't be sitting at work or going out in places and having to fan themselves all the time to reduce that heat. It isn't normal to live that way. And as the doctors say, it's temporary, it's going to go away. It doesn't always go away. Around 10% of women have hot flashes and night sweats all their lives. So it's not unusual for me to see women in their 70s, 80s, and older still having hot flashes. Well, it's not pleasant to live like that, and you don't have to. Weight gain. So weight gain affects just about everybody. Weight in women tends to start coming on in the mid-30s. So women have a few pregnancies. They often don't lose the weight from the pregnancies. And then the progesterone level drops down, and the weight just keeps coming on. And then the testosterone in the 40s drops down. And by the time women get to 50, they weigh a whole lot more than they used to weigh when they were 30. And the weight just keeps coming, a few pounds a year. So when you look at a crowd of women in their 80s or older, they're all overweight. Doesn't have to be that way. Weight gain, joint pain. So lots of people begin to develop arthritis in their 50s and 60s, and by the 70s, many of them have arthritis, and assume that it's hereditary, a parent had it, they're going to get arthritis, but it doesn't have to be that way. The joints have receptors for the hormones, and when you start the hormones before developing arthritis, you don't necessarily get arthritis. And when you have mild early arthritis and start taking hormone replacement, those pains can go away. Now, if you have advanced arthritis where the joints have already been destroyed, that kind of arthritis is not going to go away. But further development or worsening of the arthritis can be prevented with hormone replacement. No? Okay. Sometimes you speak then, sometimes you don't. Nothing to say today?
Sure. Look, I'm now 67. When I was 57, I had stiff fingers in the morning, okay? And it bothered me, and I'd ask my wife about it, and said, well, you're getting old, you know? But maybe we can work on that, okay? And sure enough, with proper hormone replacement, it's gone. And I don't have stiff fingers anymore. I'm now 10 years older and a whole lot healthier, thanks to my wife.
Okay, so that's joint pains. Migraine and severe headaches are often PMS related, premenstrual syndrome. So a lot of women get headaches starting in the 40s. Why should the headaches start in the 40s? Because they have low progesterone. And the treatment for PMS with mood swings, many husbands don't like their wives the week before the period. They say, go get something for it. Well, what do conventional doctors do? Conventional doctors just know the antidepressants that the drug company has told them to prescribe. So Zoloft and Prostate and Paxil are often prescribed. But the problem's not a depression problem, it's a lack of progesterone problem. And the real treatment that treats the cause of the problem should be progesterone, and progesterone does get rid of those headaches. Our bladder symptoms, this is men and women. Lots of them develop bladder symptoms, can't hold the urine in, have to go in the middle of the night, then the middle of the night bathroom, once becomes 2 and then 3 times, and it disrupts sleep. And some people fall right back asleep afterwards, but most don't. And then they wake up in the morning, and they don't feel like waking up in the morning because they're tired, so they need their coffee to get going in the morning, and they're on a bad cycle. So I guess this sounds familiar. All right, and then the television commercial says, go ask your doctor if Myrbetriq is right for you, or Detrol LA. Well, why should you need a medicine to help you hold your urine in better? You should go ask your doctor why you have to pee so often, and you shouldn't have to become an expert on where every bathroom is in the public places where you go in order to be able to get there in time. You shouldn't have to do it. Your urine ought to stay in for a little longer. And Myrbetriq, yeah, it'll help hold the urine in along with its side effects. The answer is estrogen and the other hormones are missing, which makes for the bladder symptoms, and in men it's testosterone. Our decreased sex drive, this often affects women at a younger age than men. This could be in the 30s and the 40s, and men are not real happy with this. So this is why I say hormone replacement can help relationships. I've had couples come in together, and it does help the relationship to improve the sexual relationship. And I've had couples say that it saved their marriage or tremendously helped their marriage. Unfortunately, I've also testimonials, not testimonials, but people have told me it's a shame they didn't know about this a few years ago, because maybe they wouldn't be divorced if they had started hormones at an earlier time. So where do you get information? I'm glad you're here getting information on this and not asking your television set for what you should do about these symptoms. I think most of these symptoms are familiar to most of you in here, some of the symptoms anyway. Don't ask the television, or don't listen to your television as far as advice. The purpose of the television commercial is not really to help you. It's to make money for the drug company. And I do have people coming in every day asking me if they can have a medicine, and if it's something I never heard of, I'm sure they heard it on a television commercial, and I'm just not watching enough television to learn all these new medicines that they're advertising for plaque psoriasis, and what else? What is big one? We shouldn't all have to listen to this for these conditions that are not very common.
Let me tell you why they're doing this, okay? Once upon a time, pharmaceutical companies sent medical reps out to the medical doctors to say, hey, I have this new drug, here's some samples and here's some brochures, why don't you try it with your patients, and then you can see whether or not they'll like it. And so they had 700,000 doctors to advertise to, okay? And then they began to think, hey, what if we advertised to 300 million people in the United States? Maybe we'd sell more drug. And in 1992, the United States became one of only 2 countries in the whole world that allows direct advertising of pharmaceutical product to the public. New Zealand is the other country. No other country does this, okay? Now, pharmaceutical ads represent about 25% of all the ads you see on television. 25%. And why? Because it works. It works. So the pharmaceutical companies are not stupid. They know how to do this, and it works well.
They took the place of cigarette ads.
That's true.
Sure, they could find what else to advertise. But now it's about a quarter of all commercials on television are for drugs. All right, so we're not going to the television, but many people try to treat themselves when they have these symptoms. So people treat themselves with coffee in the morning and then energy drinks later in the day, or maybe they start with the energy drink in the morning. B12, people come in and ask for B12. They think it's going to give them energy. B12 is harmless. It's not going to cause any bad effect. If people want a B12, I'll give it to them, but I don't think it's going to solve anybody's energy problem. It's a shame when people turn to alcohol or cigarettes to medicate themselves. People buy lots of weight loss products and weight loss bars and all kinds of weight loss things. It's a multi-billion-dollar business, the weight loss industry over the counter. And many doctors don't take the symptoms seriously. People, and they're rushed. Doctors aren't bad. They just are rushed for time. So people come in, they have pain, so they ask for a pain medicine. Doctor gives it to them. It's faster than explaining how you can look for the cause of the pain, get rid of the cause, or treat it with something naturally. It's easier to write the prescription, and it's faster. People come in depressed and anxious, so they get an antidepressant or anti-anxiety medicine prescribed for them. The people who can't sleep, doctors will prescribe sleeping pills and get people on bad habits. They don't take the time or they don't have the time to explain that sleeping pills are addictive, they're habit forming, they're a bad habit to get into. Sleep is a natural thing. Everybody sleeps eventually. They just need better sleep habits, or might need something tweaked with hormones or something else to fix the sleep, because everybody will sleep under the right conditions. Erectile dysfunction, they advertise, or doctors will prescribe for men, but not much for women. All right, let's talk about menopause and then andropause. So menopause, average age of onset of menopause is 51, plus or minus about 6 years. But the symptoms of menopause start about 10 to 15 years before menopause. So if average age is 51, menopause symptoms can start in the mid to late 30s. So it's not unusual to see young women coming in with perimenopausal symptoms, like fatigue and tiredness and no energy and cloudy thinking, foggy thinking, all the things that were on that list to begin with. Many people don't realize the symptoms that they're having. And I want to say also that 100 years ago, or a little more than 100 years ago, we wouldn't have been having this conversation because people didn't live so long. Women 100 years ago didn't live much past menopause. In fact, in 1935, the United States government set the Social Security Act, went into effect 1935, and set the retirement age as 65. So why was it set at 65? Because at that time in 1935, average lifespan was 67 years. People weren't expected to live much beyond 65, and 67 sounded fine. Now, women can live half their lives in menopause. And why should men live half their lives with low testosterone? Why not feel better and prevent disease at the same time? Doctors tell women, are you going to get over menopause? Well, women don't really get over menopause. Women often think, well, they had no hot flashes and no night sweats, they were lucky, or they did get over it and they think they're fine. But these other symptoms, the poor sleep, the waking up at 4 o'clock in the morning, fatigue, tiredness, brain fog, cloudy thinking, poor concentration, weight gain, poor muscle strength, these are all signs of menopause. And they don't have to be. This can be fixed or reversed. And as far as getting over it, you might think you got over menopause, or maybe you don't think that, and that's why you're here. But how many of you can say now that you feel as good as you did when you were 25 years old? Most people can't. How many of you can say you feel as good as you did when you were 40? Well, you replace hormones, and you can. All right. So we'll talk about each hormone a little bit, and then come to andropause. Estrogen. It's present in both men and women. Large amounts in women, very small amounts in men, and it has about 400 functions in the body. It does many things. In women, it controls hot flashes and sweats. It maintains bone density. It helps the collagen in the skin. Women pay millions to get their skin fixed and get plastic and dermatology procedures. They can do it much more cheaply with estrogen. It helps maintain memory. It went too fast. It increases serotonin in the brain, which is, didn't go back. Serotonin in the brain, which is what makes you feel good. One more back? Yeah. Okay, sorry. Serotonin and dopamine, which make you feel good naturally. You don't need antidepressants to feel good. Naturally, estrogen does it. Side effects that you've heard about from estrogen are really all from the oral synthetic estrogen. They're from Premarin. Breast cancer, heart disease, Alzheimer's, weight gain, fluid retention, blood clots, leg cramps, all this is artificial synthetic estrogen. Natural estrogen doesn't do this. Because if you look at this list of symptoms, this is not what the average 20-year-old has. 20-year-olds have high estrogen. 30-year-olds still have high estrogen for the most part, and they're not the ones who are sick with these problems. Do you know what more women die from than any other cause? What's a major cause of death among women? Heart attack, good. Some people think it's breast cancer, it's not. It's heart disease, and it's the same major cause of death in men. Men and women, the same thing. About 1 in 3 people die of heart disease, and if you lump stroke in with this, it's actually half of all people die of heart attack or stroke. And heart attack and stroke are really the same disease occurring in different organs. Heart attack affects the blood vessels in the heart. Stroke is the blood vessels in the brain. So I want to prevent this. I'm a family physician. I don't want to wait for people to get sick and then prescribe pills for them. I want to prevent these diseases, heart disease, and a major way to do it is with hormone replacement, especially estrogen. Progesterone, it's necessary for women whether or not they have a uterus. Now, women have been told classically by gynecologists that if they've had a hysterectomy, they can take estrogen without progesterone. Well, I think the gynecologists only are talking about the pelvic organs because they don't realize women have more hormone receptors in their heart than they have in the uterus. And they have receptors for hormones, estrogen and progesterone, in the brain. They need progesterone to protect all the organs, and gynecologists are only aware of the pelvic organs. I don't think they're treating the heart, the brain, the bones, the joints, the whole body. They're treating just the pelvic organs. So all women need progesterone. All right, it's put into creams, not important. Progesterone is benefit of progesterone, even for women not taking the other hormones. It's calming, it's relaxing, it helps with sleep. Women sleep better with it. Helps anxiety and depression. It helps even out the mood. It helps the bladder. A lot of good effects from progesterone. Balances the estrogen. It's a natural antidepressant. It lowers cholesterol. It lowers blood pressure naturally. It acts as a natural diuretic. Many women complain of fluid retention, diuretic, and it's anti-inflammatory. And I think as we're learning more and more about disease cause, almost all chronic diseases are caused by inflammation. And inflammation that causes one disease causes another disease. So it's the same inflammation in the body that in some people will lead to cancer, and other people to heart disease, and other people arthritis, and other people stroke or dementia, but we want to prevent inflammation. And progesterone is very anti-inflammatory, very body protective. So it's helping the immune system. More effects of progesterone. Increases the metabolic rate, helps eliminate the bad fats. Scalp hair. When you look around at a group of 80-year-old women and older, many of them have very thin hair. And progesterone has a lot to do with it. Progesterone is highest, well, in young women, but it's also the absolute highest during pregnancy. So many women notice that when they're pregnant, they have great hair. Real good hair. It gets thick, it hardly falls out, but then after the pregnancy's over, the progesterone level drops, and then the hair falls out and they're back where they started. But during pregnancy, most women have really happy with their hair. Well, after menopause, the progesterone level has dropped down, and hair gets thinner. Return of good, thick head of hair can be obtained with replacement of progesterone, but that's not a reason alone to take progesterone, but it's a very nice side benefit that comes along with it. Progesterone is very protective of the breast against breast cancer. It improves libido, helps headaches, and it's great for bone formation. It helps prevent osteoporosis. Side effects of progestin. Progestin is the word for synthetic progesterone. So Provera, which is a progestin, is not a natural progesterone, but the side effects that you may have heard of from progestins are all from synthetic, not from the natural. So blood clots, high blood pressure, stroke, heart attack, breast cancer, all kinds of cancer, dementia, poor sleep, acne, glucose intolerance, which leads to diabetes. All this is from artificial progestin. Shouldn't be used. Okay, andropause. So what's andropause? Andropause is like menopause in women. Men just don't have an exact date when it starts. It's a gradual decline. Most men have their highest testosterone between ages 18 and 25. From 25 to 30, it drops down a little bit, but not noticeable usually. Then after age 30, men lose about 1 to 3% of their testosterone per year. So by age 50, most men have noticeably lower testosterone. All right, men with disease, with chronic disease, diabetes, high blood pressure, sleep apnea, and all other chronic diseases tend to have lower testosterone. And this largely contributes to why they got the disease to begin with. So linked to heart disease also, it's underdiagnosed. Because doctors look at that lab slip that says 200 to 1200 is normal, and they tell you you're normal with a 250, when they shouldn't be, not optimal. Question, Marlene?
If a man has sleep apnea, can that be corrected through hormone replacement?
It depends. Sleep apnea is probably caused by more than just hormone imbalance, but but men with low testosterone have a much higher incidence of sleep apnea, especially thin men. When thin men have, some men who are thin also have sleep apnea, and it's worth trial of hormone replacement. Okay, the next, we looked at this already. I'll just emphasize again, my aim of hormone replacement for men and women is disease prevention. I want to keep people healthy, and as a side benefit, they can feel better. So testosterone, what it does, it protects the bones against osteoporosis, it keeps the bones thick and strong, the brain against dementia, the breasts and the prostate against cancer, the heart against heart disease, the joints, and it protects relationships. Sex drive is improved with testosterone, men and women. So testosterone is present in men and women, large amounts in men, smaller amounts in women. This I think I told you already. After age 30, it doesn't stop at 70, it keeps going. After age 30, men lose 1 to 3% per year of their testosterone. Women have the highest testosterone around age 20, and by 40, they've lost half their testosterone. And usually, with that lower testosterone level goes the sex drive.
Okay. So for men, the only hormone they get is testosterone?
Mm-hmm.
But women have to have...
Okay, women, no, testosterone is metabolized in the body to estrogen. Men have some estrogen, but they don't need to take estrogen. The testosterone will convert to estrogen, and I test the level to make sure they have an adequate amount. So men need a very small amount of estrogen, but they don't have to be given it. As long as there's testosterone, they will have estrogen.
And a woman gets?
Gets estrogen, testosterone, and progesterone.
Everything's more difficult for a woman.
You're right. Women are more complicated and men are simple.
Relative to testosterone, anyone over the age of 35 or 36 and is an athlete, you notice this, okay? They're known as geriatric athletes by the age of 35. They look great, okay? But Dwayne Wade is going to be 36, and he's at the tail end of his career. He was fantastic when he was younger. But now, even though he stays in great shape, testosterone level is dropping. He doesn't even know it.
And great shape is not so easy to stay in without hormones because lack of testosterone leads to muscle atrophy, inability to build muscle. I hear all the time people are going to the gym, they're working harder, they're doing more exercise than they ever did before, and they can't build any muscle. Well, a 20-year-old goes to the gym, and within a few weeks, you can see the muscle on them. Well, not so with a 50, 60, 70-year-old. Or older. It just doesn't happen. You have to have testosterone to build muscle and to prevent the weight gain. All right, signs, I think we covered that. All right, so symptoms of testosterone deficiency in women, some of these apply to men, but I'll get to men separately. Loss of muscle tone is everybody. Anxiety, depression, less sex drive, thinning hair, that's progesterone and testosterone, thinner hair, fatigue, low self-esteem.
Droopy eyelids.
Well, that's also this cortisol related. There are a number of hormones that feed into that, but it's largely, look, you look at the face of someone who's 70 and someone who's 20, you can tell the difference looking at their skin. Why did the changes happen? There were hormonal changes in the skin. All right, so weight gain, thinner lips. You often see that. So how many women spend how much money getting their lips plumped up? Positive effects of natural testosterone for men and women, an overall feeling, a good feeling, a feeling of well-being, increased energy, zest, interest in life, relief of depression and anxiety, better mental thinking, improved memory, better focus and thought. Testosterone protects men from prostate cancer, and that therefore has to be started before they develop prostate cancer in order to prevent it. It protects the breast from breast cancer. It protects the heart from heart disease. Men have more receptors for testosterone in their heart than any other organ. It increases bone strength, increases muscle strength, reduces body fat, lowers cholesterol, increases sex drive. Sounds pretty good.
Because men suffer from breast cancer and they suffer from bone loss, and nobody ever talks about that for men.
That's right. Well, I'm talking about it.
So am I.
Right. I'll tell you, it makes no sense to me as a family doctor knowing that women in about 5 years after menopause are going to have a tremendous loss of bone. The bone density is going to plummet. So we test bone density around age 50 or around the time of menopause, and then a few years later, and it's always dropped down. So what does conventional medicine want you to do? They want you to wait until you have osteoporosis and then take Fosamax or Boniva or Actonel or Prolia or one of the prescription medicines, which don't actually thicken the whole bone. They build a shell around the bone to make it a little bit harder. And do they really prevent fractures in the long run? Maybe. But to get real good, thick, normal bone, you need hormones. This is why people before menopause don't have hip fractures. You don't hear of hip fractures and broken bones from an injury, yeah. But otherwise, osteoporotic fractures are in the back, and the back gets bent. And hip fractures, also the wrist fractures are osteoporotic fractures also. But you don't hear about this in people younger than 50 when they have their hormones. All right,
What's the normal level for the female?
For testosterone?
Yes.
The normal levels, normal is what I'm aiming for when I'm replacing testosterone is 150 to 300. Okay, so methods of hormone replacement. Well, we could talk about the synthetic hormones, but I don't want to talk much about that because we're not replacing synthetic hormones. That's Premarin and Prempro. And then there are the natural bioidentical hormones, which I'll get to. Just the synthetic, just to say a few things about them. Premarin, Prempro, this is a picture of what Prempro looked like. Came on a dial pack. Look, it still does. Looks like a birth control pill. But the study that was reported in 2002 showed increase in stroke, increased heart attack, increased breast cancer, more blood clots, more Alzheimer's dementia from people taking it than not taking it. So it made sense to stop the study and stop it, but they should not have said that all hormones are bad. They should have said synthetic hormone is bad or just Premarin and Prempro are bad. So what they did, and they should have reported, was they were using the wrong drug. They were using horse estrogen and synthetic progesterone. They gave the wrong dose. Premarin back then came in 2 strengths. It has more. It has lower strengths now, but it makes no sense. The company that makes it ought to get rid of it and switch over to natural hormone, but they won't do that because they can't patent it. And if they can't patent it, they can't make a profit. So they were using the wrong dose. They were giving everybody the same strength, the same dose, standard dose, but if hot flashes and night sweats and symptoms didn't go away, then they raised them up to the higher strength. They never tested blood levels to see if it was even getting absorbed or what was happening. And then 2002, most people stopped. Some people didn't stop. Some people stopped and said they felt miserable. They just wanted back on it, and they would take their chances. And doctors kept prescribing it. And then they gave it by the wrong route. I didn't mention this before. Prempro is taken by mouth, and Premarin are taken by mouth. They're pills. When you give estrogen or testosterone by mouth, it gets metabolized through the liver to dangerous compounds that you don't want. They're not helpful, and they cause more harm. And that's also what part of the harm of Premarin and Prempro came from, that it was given by mouth. Hormones need to be given through the skin. And I think conventional doctors have realized this, and this is why if they're giving testosterone, they'll give it as shots, not by mouth. Okay, hormones can be given by patches. Now, patches come in the form of bioidentical natural and as synthetic. Now, we wouldn't want to use a synthetic patch, but estradiol comes as a patch for women. Vivel is the brand name, and Androderm is the brand name of androgen, of testosterone for men that comes in a patch. The problem with the patch is the hormone has to get absorbed over that tiny little area that you see. Well, the skin there gets saturated with hormone and then it doesn't absorb. So if you put the patch on the person and they're not absorbing it, they're not getting the benefit. Some people absorb it, but most don't. 45% of people don't even absorb it. Then the patches staying stuck on is also a problem. So they make patches that are meant to stay on a week, but I would never use them. I would use the twice-a-week patches because they don't last a week. People sweat and they fall off. And you can't just tape it back on. It won't have that stick. It won't absorb if you just tape it back on. So patches are not the ideal way to take hormone. Cream is another possibility. When we use cream, and I prescribe cream at times, cream is not a bad choice. It's an alternative, but I would use a natural bioidentical cream. I don't use it in a tube. I use it in a Toppy Click, which looks like this. So a Toppy Click, this one has cream in it. It's a placebo cream. There's no hormone in this cream. The other, the empty one, just a placebo, the top comes off, and I think you can see there's a little hole in the top, and that's where the cream comes. Listen carefully as I turn this to the click. Maybe in the front you could hear. If you couldn't hear in the back, I'll pass this around. When you give it a turn, until it clicks, it puts a measured amount out the top. So the dose would usually be set so I would have people using 2 clicks twice a day for women, 2 clicks in the morning, 2 clicks at night. Men, testosterone could be used 4 clicks all at once in the morning. Now this doesn't work as well as pellets. I'll get the pellets. I'll pass this one around also. This has, oh, this is coming out already. All right, this is just a placebo cream. Anyone who wants to turn this and see how much comes out has to rub the cream somewhere. It's just like regular hand cream. Here, you can take them and pass them around. Testim is a cream that's available for men. It's a testosterone cream that comes actually in little tubes. Every tube is 1 daily dose. So when you get a month's supply, you get 30 tubes. It's already pre-measured. Otherwise, if you pushed cream out of a big tube, it would be hard to measure how much you're getting. So 1 tube is a daily dose, 30 tubes per month, 90 tubes for a 3-month supply. And the problem with Testim is the same as all the commercially available testosterones for men, and this shows it. The typical man starts out with hormone replacement with a baseline level that's in the blue of 250. So we want to improve his 250 and get it up somewhat higher than that. So Testim comes in 2 different strengths. The pink line is 50 milligram and the yellow line is 100 milligram. So you can see the 100, the higher dose, after 2 months, by 2 months, has the level up to about 450, and after that, the subsequent months, it stays there, about 450. Now, is 450 high enough? No. What are we aiming for? 900. Right, 900. Thank you. 900 to 1200, right? Okay, so all of the testosterones that are commercially available are preset to raise the level about 200 points. So you start at 300, you'll get to 500. If you start out at 700, your doctor's not going to prescribe it for you because they're going to say, you don't need it. You have a fantastic testosterone at 700. So this stuff is not real useful for what we want to do with it. Now, this might get rid of some symptoms, but it doesn't prevent disease. You need a higher level to prevent disease. If all you want to prevent is erectile dysfunction, that may do it. It might do it. It might help sleep, better sleep at night, but it's not going to prevent heart disease and sleep apnea and stroke and dementia and cancer, the main things I want to prevent. All right, so testosterone shots, I just want to mention because I think you know they exist. Only testosterone for men comes as shots, and many doctors give them. The insert that comes with it, the instructions on testosterone injections, advise giving it once a month, up to twice a month. It could be given every 2 weeks. Well, every 2 weeks is not enough. It wears off after a few days. So when men get it every 2 weeks, they feel good for a few days, then it wears off, and they look like they're like him. They're grouchy, grumpy, and they can't wait for the next dose. And also, testosterone injections, it comes in a thick oil. So it comes in a large-sized needle, and it has to be injected deep into the muscle. So they're long needles. Men are taught to do this at home, to inject themselves either in the butt or in the thigh. And it really ought to be given twice a week if men are going to treat this way. Now, why they would want to, I don't know. It's synthetic hormone. There's natural hormone that works better and accomplishes what we want because synthetic hormone is not good for the liver. It's toxic to the liver. It increases the incidence of heart disease. It raises the bad LDL cholesterol, lowers the good HDL cholesterol.
But you feel better.
But men feel better, but they're damaging themselves. It's the same story with Premarin and Prempro. They're causing themselves harm in the long run by using the shots. And many doctors won't prescribe it as much as twice a week. And also twice a week, 52 weeks a year, that's 104 shots a year. Do men really want to do that? All right, so this brings us to natural hormone pellets. Hormone pellets are the preferred method of hormone replacement. Now, in the past, they made them from soy or yam. Soy is no longer used. They're made from yam. It's not the supermarket yam. It's a special, what did you find that name was? Wild Chinese yam, or some kind of a fancy yam that has a structure in it that's similar to all these hormones. The hormones are not that different in chemical structure from each other. So they get a structure out of this, they alter it in a pharmacy lab to make it identical to what the body makes. So that when we use this hormone, people cannot tell the difference between natural hormone, or between their body doesn't know the difference between their own natural hormone that their bodies made when they were younger, and the hormone we're using for replacement, the bioidentical natural hormone. Same structure, so the body has the enzymes to metabolize it, where the body doesn't have the enzymes to metabolize Premarin and Prempro. Pellets are what we use. You can see it in the palm of the hand there. I'm going to pass them around. This lasts longer than the other methods. The injections, I said, are twice a week. The patches would be used twice a week. These, once the pellets are put in, for women, they last 3 to 5 months, and then they're replaced. And for men, 4 to 6 months. Not replaced, just new pellets are given. What's in the pellets, I should show them already. What's in the pellets is 100% compressed hormone. There's no filler, there's no preservative, there's no nothing else. So I have 3 pellets here to pass around. The largest one is a men's testosterone pellet, 200 milligrams. The smaller testosterone, which is still just as long but thinner, is a women's testosterone pellet. And the tiny little one that you have to look hard in the bottle to find it, that's a typical women's estrogen pellet. Now, please don't open the...
You don't mix the pellet into like the...
No, I put separate pellets, I line them up end to end, and push the whole thing in. The way I get them in is I numb up an area on the butt. They go into the butt, behind the hip. I numb up the area with lidocaine, make a 3 millimeter incision. You know what 3 millimeters is? I didn't bring something to show. Tiny, tiny. In women, 4 millimeters in men, because the pellets are bigger in men. And through that one incision, I put the pellets in and then close that little incision with a steri strip. There's no stitch. And it heals over the next few days. So in women, every 3 to 5 months they come back, and men 5 to 6 months. This actually is the most studied, well-known form of hormones. It provides a steady stream of hormone. Now, it's not a slow-release pellet. There's nothing in it to make it release slowly, but blood circulation forms around them, just like natural hormone would be secreted from the glands. Circulation, little capillaries, blood vessels form around the pellets, and when you're more active and your heart beats faster, the body absorbs more hormone. And when you're sleeping at night and your heart rate goes down, the body absorbs less. So there's a natural little variation during the day, higher during the day, less at night, and it's just what you need. It gets absorbed the way we expect it to. Then it circulates in the blood, which is the way normal hormones do. It's individually dosed. I dose it by a blood test, put them under the skin, I explained that, and once they're in, you don't even know they're there.
You go through the same, well, once it heals, you don't go through the same.
I don't go through the same one because it makes a little bit of scar tissue. I go right next to it. I'll tell you, in at least half the people I put them in, I can't even find the spot where I put them. Skin heals, the edges are pulled together with a steri strip, and I can't even find the spot. If I can't find the spot, I just pick another one. If I can see where the spot is, because they heal with a little bit of a scar, I'll go next to it and I'll line them up. I'll say of all the people I've ever put pellets in, I only had one person complain she couldn't have a scar showing in her butt. Well, she was a triathlon runner. She did triathlon with running, and she wore this little G-string type of a suit, and she said everybody's going to see it. She didn't want anyone to see that spot. I've had nobody else complain about that little mark that they get. If you think of it, who's going to see the spot on your butt other than your partner who appreciates what's in there?
Right, but after so many years, you're going to look like a patch back there.
No. They heal, scars go away, you can't find them. Yeah, how long? That's the answer. How long do you want to stay healthy? Yes. I have people in their 80s on hormone pellets. I don't happen to have anyone in their 90s in my practice, but colleagues of mine do. There are people in their 90s getting hormone replacement. And why not? If it's going to keep you healthy, look.
Eventually, the insurance is going to cover this at some point. If everybody's bleeding.
I don't know. How can I know what insurance is going to do? That's not a fair question, but I'll try to answer it. It's not likely because insurance in this country is set up so it's not here to keep you healthy. It's to take care of illness. They will treat your illness, but they won't do anything to keep you healthy because they have no interest in your long-term health. For all they know, you're not going to be with them next year. First of all, working people generally don't die before 65. So working people are all going to change insurance when they get to be 65 years old. They're going to change to Medicare or some other kind of a plan. So why would the insurance younger than age 65 care to keep you healthy? They're not going to be with you when you get older and you get sick. Older people, all right, they have Medicare, but it's different in different states. And for all they know, well, you live in this state this year and next year in another state. So they have no long-term interest in your health. Now, it isn't this way in countries where there's, what do you call it? Socialized medicine. And they are interested in keeping people healthy. Many of those countries do cover it, but that doesn't concern us here. So what will insurance companies ever do to keep people healthy? I don't know. At this point in time, I think if you want to be healthy, you have to take it into your own hands and get educated. And I can help people do this, get educated in the right direction, not just for hormones, but other illness prevention in order to stay healthy. But insurance does not cover this. All right. Question, Steve?
Well, wait to the end, or I don't know. But
no, I'm not at the end yet.
No, I can wait to the end of it.
Oh, okay. You can ask questions if it concerns everybody. If it's a personal question, I'll answer everybody's personal question at the end.
Hopefully this protects everybody. When you exercise, I've heard that you can increase the testosterone in males more so, right? For exercising vigorously. So how does that, to what extent, what percentage can you increase it from exercise?
I don't think you're going to get it up to 900 by exercise alone. Yes, you can raise it by exercise, you can raise it by healthy diet, you can raise it by healthy lifestyle, by not drinking too much alcohol, by not smoking cigarettes, by not being overweight, and by not eating sugar. These are some natural ways to raise up testosterone.
Okay. But so you can, but you won't get the same effects as percentage.
You won't get it as high. I don't think you'll get it as high because the body just isn't used to making it as you get older.
Okay.
All right. Look, if you think back in history, people lived to reproduce and then they died. They usually died of infectious disease back then or injury. But people didn't live as long as they live now. And as long as we're living longer, why not live healthier and feel better, feel good while you're doing it?
Second question is, do doctors get paid by pharmaceutical companies to push their drugs, to sell their drugs? Do they get kicked back?
No, they don't get paid directly, but medical education is very expensive. And drug companies contribute, they contribute a tremendous amount to medical education in medical schools, and they therefore have a lot to say about how doctors are trained. So I work with medical students. I have medical students come into my office, and they're being taught to either prescribe or do surgery.
But they do get gifts.
From the drug companies, not anymore. It's illegal. No, used to. In the old days, not anymore. No, the lawyers put an end to that. Lawyers can get gifts from various companies, but doctors can't get anything. No pens, no pads of paper.
Free samples.
But samples.
Promote the drug.
I wouldn't want to take those samples. I wouldn't take them, and I wouldn't give them to my family. So, all right, they give samples in order to promote their drug so people will get started and then buy it. Once a drug is generic, they don't sample it. Okay, so what we have up here, different methods of hormone replacement. The pellet is the implant. The yellow line gives a fairly steady stream. This is over 4 days. The pills, which we're not using any pills, there aren't any natural pills, you get an up and down level. It goes up for a few hours and then it drops down. And a patch, you have an up and down over a 3 to 4 day period of time. So pellets will give the most even level. I want to talk a little bit about the history of pellets. You might wonder, why did you never hear of pellets? It seems to be a relatively new thing. How come we haven't heard a whole lot about them? They've really been around since the 1930s. They went into use in 1939 in Europe. They started being used in America in 1949, and they've been used ever since. And they really have been used in America until 1962 or 1962. So you know what happened in 1962 that pellets went out of favor? What?
No more yams.
No, they're always yams. I think they made them more of the soy back then, but soy wasn't GMO back then, so they could use soy. No, Premarin and Prempro came on the market in 1962. So the drug companies came to the doctors with the free samples and said, why don't you prescribe this drug? What are you going to put pellets in for? Women can take a pill every day and they'll be fine. Well, they weren't fine. They thought they were fine for 40 years until 2002, when the evidence came out and showed that they weren't fine on that hormone replacement. So in those years, in the 60s, 70s, 80s, 90s, Premarin and Prempro were the main drugs prescribed for hormone replacement until 2002. So, but they've always been used. Pellets have always been used in Europe, Asia, Australia, Japan, popular there. All right, and big studies have been done in those countries. Now, some doctors will say, well, no studies have been done on hormone pellets. They've been done. They've just been done in other countries because drug companies put up the money for drug studies, and they're not about to pay for natural hormone investigations here, drug studies, because there's no profit. It's all generic. It's made by compounding pharmacies. All right.
They just were never heard of.
You hadn't heard of them?
No.
Well, that's because the drug companies didn't want you to hear. You'll never see a commercial on television.
Right. I didn't hear about it until I heard about it on TV.
There won't be a commercial on television for it because who's going to pay for it?
It was Jersey Housewives.
Yes, Jersey Housewives.
Right. That's the first time I've heard about it.
She uses the same. We have her on a video. You're right. She became outspoken for it because she has Biote, the same ones that I'm using. All right.
Suzanne Summers, too.
Suzanne Summers does not use hormone pellets. As far as I know, she's using hormone cream, but she promotes bioidentical hormone replacement. Now, she does it in a different way than anybody else. She does it by taking progesterone in a cyclic way, so she gets a period every month. Now, she's in her 70s. How old is she now? 70? She's older than 70. Okay. So she gets a period every month. She thinks that's natural. Well, in a sense it is, but it's not necessary. When progesterone is taken for 3 weeks on and 1 week off, you can make yourself get a period. But most women that I come across don't want to have a period after menopause. So I don't have very many who want to have the period, but I can do it for them if they want. I know, you're getting weird looks. All right, so what's Biote? I mentioned Biote because, what's her name? I don't watch Housewives, but what is it?
Snooki.
No, is it really?
Fielder.
That's her name?
Yep.
Oh, what do I know? I don't watch it. So she has Biote pellets, and after she got them, she felt so much better herself that she let it be known.
On an airplane. She sat next to, what's his name?
Sat next to Donovitz, Dr. Donovitz, or somebody he works with?
What's the Indian guy?
One of the,
Chopra?
No. He works with Biote. I know who you mean, from New Jersey.
Yeah.
Don't worry about him. All right, so Biote. What's Biote? Biote you see down in the right-hand corner of most of my slides. That's the company where I get my pellets through them and my medical education through them. And their sort of motto is let people live healthier and feel better with natural hormones by prescribing the right kind of hormone, natural, bioidentical, in the right amount, individualized dosing, and the right delivery system through the skin. Pellets, or if not, they don't talk about cream. Cream is separate. Cream isn't through them. And the studies have been going on. Actually, it's almost 80 years. They were started in the 1930s. It's 80 years. Long-term safety record in 5 continents. Steady state of hormone. No roller coaster effect. It's only a few times a year. Men basically get hormones put in twice a year. Women 3 or 4 times. Side effects would be the same side effects you had when you were 20 years old and you had high hormone levels. What bad effects did you ever have from your hormones? All right, so this is the best method to increase bone density. Makes much more sense than taking Beniva or Fosamax. It lowers the risk of breast cancer, blood clots, heart attack, stroke, and it protects bones, brains, heart, relationships. All right, I have a number of studies that show that it's effective. Did we see enough? I'll just skip this or go through it quickly. All right. saying estrogen can cause breast cancer when it's used without progesterone, but with progesterone it doesn't. The progesterone protects it. Estratest right here is an oral form of estrogen combined with testosterone, but we don't want to use that. It causes more disease. It gets rid of symptoms, but it causes disease. But when they take the testosterone out of the pill and give it through the skin, it lowers the risk of breast cancer. Pellets have been used in women after breast cancer, but a number of years after. I want to skip these studies. Breast cancer studies all show that it can be safe after breast cancer is gone. Osteoporosis, up to 8.3% increased bone density per year with hormone pellets. This is a big reason. I have some women coming to me with no symptoms. They feel fine, they feel great, but they have osteoporosis. They were diagnosed with it. They don't want to take Fosamax or any other synthetic drug. I have them on hormones with no symptoms at all. Those women get pellets every 5 months. All right, because we have no symptoms to go by to know when they need pellets again. Alzheimer's, I mentioned before, we can prevent Alzheimer's or at least lower the risk, tremendously lower the risk of Alzheimer's with hormone replacement. Women are 50% less likely to get Alzheimer's when they're on hormone replacement. Men with low testosterone, much higher risk of Alzheimer's, and I said over 900, tremendously lowers the risk. Less blood clots with hormones, less breast cancer. I think I sort of said this, there's more breast cancer. Oh, cholesterol, the cholesterol pattern is improved with hormone replacement. Arthritis, okay, so we can lower the progression of arthritis with hormone replacement because there are receptors in the joints for the hormones. What patients are saying who are on this, they have increased energy, they feel good, increased interest in life, increased sex drive, better mood, more even mood, less anxiety and depression. I've had many people come to me on anti-anxiety and antidepressant medicines, and after some amount of time on hormones, can wean them off those medicines. Especially if those medicines were started in the 40s or late 30s or in the 50s. Depression and anxiety starting at that time, that's a hormone problem. It's not the body doesn't have a deficiency of Zoloft or a deficiency of Prozac. The body's lacking hormone, and that's the reason for the anxiety and depression. All right, so there's increased mental clarity, focus, memory, decreased body fat, and increased ability to build muscle going to the gym and exercising. And I believe, like Biote says, that people deserve to live a better life, feel better, live longer. And this leads to functional medicine involving finding the cause of medical problems, not just prescribing a medicine for every symptom. The American drug pharmacy industry would have, and television commercials would have you believe there's a drug for every symptom. Whatever symptom you have, just go ask your doctor, there's a drug for it. But then there are all those side effects if you listen to the end of the commercial. So I think we're seeing a paradigm shift away from managing disease to preventing disease through functional medicine. So key take-home facts, we're getting to the end. Key take-home facts. Hormone balance occurs in men and women. It can occur at any age. My youngest patient is now 18 years old. She was 17 when we started. She has a birth problem. Otherwise, my youngest patient is in the later 20s. Later 30s, it becomes much more common, and many in the 40s, 50s, 60s, 70s, and some in their 80s. There's no age that's too old to start. And balancing hormones is not a one-size-fits-all. It's done by blood test, and actually I use a computer program that helps me calculate the dose using a combination of symptoms, like what you have on the pages in front of you that were on your chair. It combines the symptoms, the blood test result, age, and weight. And I calculate a dose. And then through Biote, and then we discuss what the dose should be. So it's individualized. How you find out what you need, you have to get tested. Low levels are not normal, and at the same time, I optimize vitamin D. Vitamin D is really not a vitamin, it's a hormone. It's still being called vitamin D, not hormone D. But by the definition, it's a hormone. It's made in the skin with sunlight, made in the skin, it then travels through the body to all the other organs where it has its effect. So someday they'll change and call it, let everybody know it's really a hormone. So I optimize vitamin D at the same time, and thyroid, and sometimes cortisol, and other hormones if we need. So how do you get started if you're interested? We have Tiffany here for blood draw tonight.
Not here yet.
Okay, she will be then. I went fast tonight?
No, on time.
Okay, so I'll take questions and I'll answer individual questions. Questions first, they concern everybody. Do you want me to talk about the cost?
How long does it take, like, okay, I know you said it's preferable, like, is there a point where they say, okay, can I see if I can do without it, or?
Why would you want to? If you do, I can tell you, if you do without it, your levels are going to go back to where you were before you started. There's nothing in this that's making your ovaries work better. At menopause, ovaries stop working. They don't produce progesterone or estrogen anymore, or testosterone. So this treatment is not going to kickstart your ovary to work again and produce hormones again. So no, it's a long.
Once you start, you can't stop.
Well, you wouldn't want to stop. I have people who stop, who can't afford it or whatever, or they move out of area, or I can help them find another doctor because Biote is all over the country, and now it's in Mexico and Canada also. So I can help them find a doctor, and I have that. I have snowbirds coming to me who I can help them find a doctor in the other area where they are. So half the year they come to me, the other half I find them somebody else. Okay, the cost. Meg has estimated that the cost for women is about $1,600 a year and for men $2,400 a year, but it's different for different people because we don't charge a yearly fee, we charge by what we do. So each time I put pellets in, for women it's $350. So that is either 3 or 4 times a year, it depends on when you need them. It might only be twice a year, but it's usually a little bit more. Progesterone is taken by mouth. Progesterone is safe to take as a pill or capsule by mouth, and the cost of progesterone depends on the strength and the dose, and I need the blood test to know that. It's about a little more than $100 for a 3-month supply. So it's about $420 for the year for progesterone. The other expenses, there are a few supplements that we use. Thyroid, we can usually get insurance to pay for thyroid, but they might not, because I'm using natural thyroid, not Synthroid or levothyroxine. So the natural thyroid, with a GoodRx coupon, which is a discount if the insurance doesn't cover it, it's about $21 or $24 from Walmart for a 3-month supply. And that depends on the strength also. So it's not an expensive medicine for thyroid, not an expensive cost for thyroid. Other DIM is a supplement that everybody has to take. So with the supplements and everything, it adds up, but I can't say exactly what it's going to cost because it depends on your dose and how often you need them.
So if women are more complicated, why are men more?
Because testosterone is expensive. Because men get a lot of testosterone. A typical women's testosterone, that's a good question. A typical women's testosterone dose is somewhere between 87 and 150 or 175 milligrams. Men get somewhere between 1,000 and 2,400 milligrams, and those testosterone pellets are big, and testosterone costs a lot. Just more expensive. That was a reasonable question. That was good.
The $450 is just including the pellets?
$350 to put pellets in women. 350 pellets, but you don't know if that's going to be 2 or 3 or 4 times in the year.
Right. That's including in the exam and...
Okay, the exam and the office visit. So my first office visit, initial visit, I charge by the hour, is usually $300 for that first visit, but you're getting a discount because you were here. So that takes half off. So the first visit, when I would go over the blood test with you, and you've gotten enough education now that you can go straight for the blood test. Tiffany come in yet? Yeah. Tiffany's here, okay. So we can draw blood tonight if you'd like. Anyone who draws blood, the blood test, insurance doesn't cover it for the most part. We don't even try. Because if you want to send it to Quest or LabCorp and they don't cover it, they're going to want you to sign an ABN form, meaning that you will pay if the insurance doesn't, and then the cost is going to be about $1,000. So our cost is $150 for the first blood draw, and then $100 for subsequent blood draws. Now, men get blood drawn every time they get hormones put in, because I have to check a PSA and a blood count and other things have to be done minimum every 6 months, so I can't go twice without doing it. So I do it every time. Women, I check the level. In fact, for everybody, I check the levels 4 to 6 weeks after we start, and then I meet back with you. So that office visit is $75. We can usually do it in about a 15-minute time slot. So it's $75 for the office visit. And after that, there's no office visit charge for the next visits because it's the hormone is paying for it.
Just like on cortisol, it's less than 4 times
times a day to really get the accurate levels. With hormones?
No, they're not changing that much. They're not changing that much through the day. Now, women who...
A day, but don't you have to be in a certain day of your cycle to really get
Yes, yes, I do need that. For women who are still cycling, I generally want to check it in the second half of the menstrual cycle, meaning if for a 28-day cycle, I would want the blood test day 18, 19, 20, or 21, where day 1 is the day the period starts. So for women here now who are cycling and want to get their blood test, I'd rather not do it tonight. I'd rather wait till the appropriate day. All right, for women past cycling, menopause, it doesn't matter, anytime.
So how much is for the labs for tonight?
Lab tonight would be 150. And then the first time you come in to see me, I'm checking the hormone lab that I need, which is estrogen, estradiol, testosterone, progesterone, SHBG, which is sex hormone binding globulin. I check 4 thyroid tests. The 3 thyroids that I mentioned up here, free T3, free T4, TSH, and a thyroid antibody. I want to know who has Hashimoto's. And what else? Vitamin D. I'm checking vitamin D. If it's all done, if it's all been done elsewhere, I'll accept other results, okay? I'll accept results that were done elsewhere, depending on the lab. I haven't come across a lab that I really don't want to depend on, so I would want to see who did it. All right, is that it for the questions?